China is experiencing its biggest COVID surge since early in the pandemic. Millions of people have been locked down in cities across the country, from the tech hub of Shenzhen to the 24 million people living in Jilin province. And as China tries to contain the spread of Omicron, one group is particularly vulnerable: the elderly. Unlike many other parts of the world, China hasn't mandated vaccinations. Instead, China's National Health Commission said vaccination should be voluntary. But there have been reports of some local authorities bringing in vaccine mandates. Human Rights Watch said a frenzy of forced vaccinations began last July after President Xi Jinping set a target for fully vaccinating 80% of the population. According to China's National Health Commission last month, more than 50 million people over the age of 60 remain unvaccinated. That's about 20% of the older population. But these figures from the National Health Commission haven't changed since late November. And for those aged over 80, the vaccination rate in some areas was under 50%. Officials have warned the vaccination rate for over 60s needs to rise. In recent weeks, China has gone from reporting under 100 daily infections to more than 1,000. The latest figures reported by the National Health Commission were more than 2,200 daily cases. Data collected by Johns Hopkins University shows much higher numbers of cases than the official figures, which don't include asymptomatic cases. So why are there still so many elderly people without boosters or vaccines? Some blame the circulation of fake news on social media for the lower rates in elderly people.
At first, I also very confused why they don't want to get vaccinated until they sent me many messages. I think they are all fake news. For example, the vaccine is ineffective or not safe.
While Yuan is fully vaccinated, her mother and father are not.
My sister and I tried many times to persuade them, but failed. And even now, the COVID-19 outbreak is continuing to grow in Weifang in my city, but my parents are asked to self-quarantine at home, but they still don't want to get vaccinated.
The vaccination rates of the elderly could also be lagging because over 60s were not a priority group, and vaccines were first rolled out to younger adults.
The most risk groups who can spread the virus will be those younger people who are highly mobile, while the older people, most of them may stay at home or stay in their own communities.
Mr. Liu says a lack of scientific data on the impacts of Chinese vaccinations on the elderly also led to a delay in the vaccine rollout. And complacency may have also played a part in the slower uptake of vaccines by the elderly.
Old people may have become complacent, given the safe feeling. So the uptake of vaccines may be slow. So it happened in many countries.
As COVID continues to spread, the National Health Authority has adjusted its COVID strategy to free up more medical resources by allowing rapid antigen tests and no longer sending mild cases to hospital. But President Xi confirmed last week China's COVID-0 approach would continue, and he called on people to get vaccinated.